A warm welcome to everyone to this special council meeting for the town of Oakville. Madam Clerk, is everyone here? Are there any regrets?
There are no regrets.
Thank you. Council, are there any declarations of pecuniary interest to declare? Madam Clerk, I see none. Council, our one and only discussion item tonight is the mandatory mask wearing in the COVID-19 pandemic. And there's a motion that you've all received, moved by Councillor Adams and seconded by Councillor Duddeck, which is an instructive motion full of evidence and interesting observations, as well as some operational parts. And I would ask the mover and seconder if they want to take turns reading it. I only say that lightly because it's somewhat long. But anyway, Councillor Adams, I think, and by the way, we have 2 registered delegations. And if the public would like to call in, the number is 905-815-6095, and we'll connect you to the meeting and receive your information. Councillor Adams, you have the floor.
Thank you very much. I appreciate you letting us put this on the floor to start with, and I hope it's helpful in directing the discussions. And so you all should have received the communication from the clerks earlier today, and I want to make sure that it's available for the public as well. I do wonder whether the clerks could put this up so that others would be able to see it should they be watching from home. But I will read it into the record so everyone can hear it. And I worked with Councillor Duddeck on this, and this motion, I hope, has benefited from some of our neighboring municipalities who have already gone through this, and so you may see elements of it being drawn from some of our friendly neighbors. It reads, whereas novel coronavirus is present within the town of Oakville and Halton region, and it causes the disease COVID-19 that is readily communicable from person to person, including through droplets from an infected person, and carries a risk of serious complications such as pneumonia or respiratory failure, and may result in death. And whereas COVID-19 has been declared a global pandemic by the World Health Organization, WHO, and whereas the mayor of the town of Oakville has declared a state of emergency,
Councillor Adams, excuse me.
And, yeah.
I need to ask you to read it slower so that people following along at home can understand it. We have all the time in the world, and you don't need to hurry.
Thank you for that. I appreciate if the audio is not quite as good as it might normally be. And whereas the public health and safety of residents and visitors to the town are of the utmost importance during the COVID-19 pandemic, and whereas the risk of contracting COVID-19 increases when in close proximity, less than 2 meters, to an infected person, and when within an enclosed building, such as a retail store or mall, and whereas there is a growing body of evidence that outlines the effectiveness of a mask or face covering to act as a barrier to prevent the spread of COVID-19 to others, and whereas persons with COVID-19 may show no symptoms of the virus and may not know that they are infectious, and whereas the risk of contracting COVID-19 in enclosed spaces decreases if the majority of people, both employees and customers, are wearing a face mask, and whereas an increasing number of municipalities, including Toronto, have mandated the use of masks or face coverings in enclosed public spaces, and whereas consistent rules across the Greater Toronto Area will improve the ability of the public to understand and comply with mandated use of masks, and whereas more public spaces are now being reopened and attract increasing numbers of people who may not be able to maintain physical distance from others within an establishment, and whereas the use of face masks as an additional public health measure is supportive of the continued efforts at reopening the economy while reducing the risk of a second wave of COVID-19 cases, and whereas Halton Region and the town of Oakville have the authority to pass bylaws respecting matters related to the economic, social, and environmental well-being of the town and the health, safety, and well-being of persons, and whereas the following is deemed necessary as there exists a pressing need for establishments to implement appropriate measures and regulations to better prevent the spread of COVID-19 and protect the health, safety, and well-being of the residents of the town of Oakville within enclosed public spaces, and where it is believed that the existence of such a bylaw requirement will help to educate the public on the importance of a properly worn mask or face covering and encourage voluntary compliance. Therefore, be it resolved, 1, that the town of Oakville requests that Halton Region enact a temporary mandatory non-medical face mask or cover wearing bylaw for enclosed public locations generally consistent with the Toronto bylaw in order to ensure consistency across all region of Halton municipalities and across the GTA. 2, that staff prepare a bylaw to enact a mandatory non-medical face mask or cover wearing requirement for the town of Oakville, generally consistent with the Toronto bylaw, to come into force 7 days after its passage, and that the bylaw be brought forward to town council at a special council meeting called by the mayor to be held after the July 15, 2020 meeting of Halton Regional Council. 3, that the said bylaw in paragraph 2 be deemed to no longer be in effect and revoked after September 30th, 2020, unless extended by further bylaw of town council. 4, that the need for such town bylaw be reconsidered at the special council meeting called by the mayor if the bylaw is made redundant by Halton Region enacting a similar bylaw. And 5, that this resolution be circulated to all local Halton municipalities for their information. I believe that the important element to understand about this is it intends to ask the region of Halton to act for the entire region and to reduce the piecemeal approach that would occur if each local municipality passed the bylaw by themselves. I understand that Burlington and Halton Hills are already on their way to doing so, and Milton is moving forward as well. We do have a meeting next Wednesday on this matter at the region of Halton, and it's my understanding that staff will be presenting regional council with options to proceed with the bylaw. And it's my understanding that there will be enough votes to pass it there. And so this is urging on the region to do so and preparing ourselves in the event that something goes amiss with the region and we wish to do it ourselves.
Thank you. Thank you, Councillor Adams. Councillor Duddeck.
Thank you, through you, Your Worship. I wonder if, for the benefit of the public and for perhaps a couple of my colleagues who maybe haven't had a chance to look at their emails as yet, the most recent email we received from Dr. Magani at the health department at the region that was shared with us late this afternoon.
Councillor, Dr. Magani subsequently communicated that she'd be happy to have that letter shared with the public, and I think you should feel free to read it. And if you do, I would suggest you read it slowly for everybody, because the slower you read, the easier it is to understand over these electronic things. And we may be able to put it up as well. We're checking here, but it should be read anyway. We'll, if you want to wait 1 second, we'll see if we can put it up. It may be about to come up. It may be just a little hard for people at home to read, though, so it'd be good for you to read it.
Thank you. It's today's date, and it is regarding face coverings or non-medical masks. Dear members of Regional Council, and I would assume also local councils, as the medical officer of health, I continue to strongly recommend the use of face coverings when physical distancing could be a challenge. I'm also supportive of approaches and measures that aim to increase the use of face coverings as an additional layer of protection in our response to control COVID-19 in our community. Should a municipality choose to implement a bylaw for this purpose, I would support this. Current evidence indicates that COVID-19 is mainly transmitted through respiratory droplets expelled when a person with COVID-19 coughs, sneezes, or speaks. Individuals can become infected by breathing in these droplets or by touching contaminated objects or surfaces and then touching their eyes, nose, or mouth. Face coverings or non-medical masks can act as a barrier to help stop the spread of droplets. Evidence about COVID-19 and its prevention and treatment is continuously emerging. While the existing body of evidence regarding face coverings is not conclusive, wearing a face covering when physical distancing is a challenge may help to reduce community spread of COVID-19, especially from individuals who are infected with COVID-19 but asymptomatic. Some municipalities have developed bylaws to mandate use of face coverings in indoor public spaces. It is also important to continue to encourage residents to wear face coverings in other situations where physical distancing is a challenge. For example, crowded outdoor gatherings. I'm proud of the Halton community's effort to date in flattening the curve through physical distancing, washing hands regularly, and staying home when ill. These important voluntary actions have allowed us to have fewer cases, hospitalizations, and deaths compared to early projections. As we prepare for a second wave of COVID-19 and the influenza season, it is important to maintain a culture of precaution while the economy reopens. Increasing face covering or non-medical mask use is one additional way we can protect each other. Wearing a face covering is not a substitute for other public health measures, and alone is not enough to prevent the spread of COVID-19. It is essential to continue to maintain physical distancing whenever possible, wash hands regularly, and stay home when ill. Thank you for your ongoing commitment to protecting the health and well-being of Halton residents. And it's signed Dr. Magani.
Thank you very much, Councillor Duddeck. Anyone else? Councillor Giddings, and then Councillor Knoll, and then Councillor O'Meara.
Thank you, Mr. Mayor. I'd like to thank Councillor Adams and Duddeck for bringing this forward. If I could ask a question of them regarding therefore clause 2. You include that the bylaw be brought forward to town council at a special meeting called by the mayor to be held after the July 15th meeting of regional council. Just wondering if you would consider including the setting of a date this evening so that we have it in the calendar and to ensure that staff have the required time to prepare the bylaw that we're after.
Your Worship, if I can speak to that.
Councillor
I would
Adams?
be happy with choosing a specific date and time if it helps with the scheduling for members of council. It was left specifically to the mayor to choose a time and date in order to give flexibility around that specific issue. My expectation is staff would be able to turn around a draft bylaw in that period of time.
Thank you, Councillor Adams. We know that Halton Hills has theirs in place currently. Milton, I believe, is bringing it to their council, if necessary, on July 20th, and Burlington, July 13th, I believe, next Monday. So I think it's necessary to have it within that time frame, if not before.
Councillor Giddings, I'm happy to tell you that I would welcome you inserting a date, and I would propose that you make it the afternoon of July 16th. That'd be the very day after the region's meeting. And I have no doubt that our staff would be able to be prepared by then.
An ideal date, in my view, Mr. Mayor, if that meets to the satisfaction of the mover and seconder.
I would be open to what you're proposing, absolutely.
And I would too, if you wish to put in the 16th, and your worship, if there's a specific time that is appropriate based on the clerk's work beside you, that would be okay.
7 p.m. How's that? It's at the nomination of the clerk. There must be a reason.
Yes, 7 p.m. is okay by me.
All right, well, you know, it's important to happy clerk, happy council. And is that it for you, Councillor Giddings? Shall I move to Councillor Knoll?
By all means, thank you.
Councillor Knoll.
Thank you, Your Worship. Is this an appropriate time for comments on the overall issue or simply dealing with the motion itself? I have a matter on the motion, just a technical matter.
Well,
Do you want comments after delegations or before delegations?
The motion's on the floor. When questions and comments about the motion from council are finished, was my intention to call the registered delegations, and at that point, subject to what the delegations gave you, a vote would be in order, I would think.
Okay, so I've got one technical thing similar to Councillor Giddings, but it's a little more finicky as the rules of order guy that I tend to be. The section, paragraph 2 presupposes proceeding with a meeting whether or not the region passes the bylaw. So I'm wondering if it would be appropriate to insert the words that should the regional council not approve such bylaw between the words that and the on the third line. And that way you don't have to, we don't have to call the meeting and have the meeting for no reasons, because this is an enacting bylaw or an enacting motion. I don't want to put us through a lot of work we don't need to go through.
Well, it's I don't have a position on that. I believe from the way it's written in the rest of it that the mover and seconder were contemplating having the meeting in case the region's bylaw didn't satisfy them.
I understand. Again, just being very picky about this. I just think it would be nice to have that there so we don't put the clerk's department in a quandary. Maybe perhaps if one of the clerks wants to weigh in, I don't want to create a meeting or create any uncertainty for any reason on this.
Well, this is a matter
What
for the.
do Councillor Adams and Councillor Duddeck think? I guess would be the biggest question.
I was going to say, I think this is for the mover and seconder to consider your advice and respond. Councillors, Councillor Adams, and then Councillor Duddeck.
One of the reasons for the original wording was to allow flexibility to the mayor on the issue. And so choosing a date allows council, it may be a very short meeting. It might be simply a meeting that says, yeah, we're done. We don't need to do anything more because the region's acted. On the other hand, there may be a wrinkle that we cannot foresee until July 15th.
So maybe I did not explain myself correctly. I support what Councillor Giddings requested. I think that's prudent. What I'm suggesting is that this motion calls a meeting whether or not the region passes the bylaw. All I'm trying to do is give us an escape clause to avoid the cost of bringing staff in and formally holding a meeting, etc., should the bylaw get passed at the region.
Sorry. I'm okay either way. If one wanted to try to draft in a exit clause, I think
it's a couple words.
The question I think for council you'd have to wrestle with is at what point are you sure that everybody on council is satisfied with the outcome of the region with respect to how things are dealt with in Oakville?
I'll leave it at that. Just concerned about, calling a meeting is simple. There's a cost always to that. And if we've already got the bylaw, there's no reason. But my wording was simply should the region not approve such bylaw, and you can put the words to the satisfaction of the town of Oakville, that, and then have the balance. But I'll leave it to you. If that's not of interest, I'm not going to push it further. And I have Mr. Mayor, I do have something I do want to reserve comments until later, but I do have something I'd like to read into the record, if you don't mind, that came in really late. Is that okay?
Certainly.
Sure. This comes from Dr. Natalia Alma, who is, the mayor knows her quite well, and I think a number of you also know her. Nadia is a past president of the Ontario Medical Association. She's a current board member of the OMA. She is a doctor that works for Halton Healthcare Corporation at both Georgetown and OTMH. She's in private practice in Georgetown. She's quite the wonderful doctor in terms of community support and everything else she does. She's also an anesthesiologist, and she's often the last person that people see before they get the tube, as she refers to it, when they are dealing with COVID. Not that we have anybody that's in that position today. Anyway, this is what she sent me this note. I don't think she realized this was coming up, so she sent me this note, and she asked me to read into the record. I believe in universal masking. It is one of the ways we can resume our lives even with the pandemic still present. By themselves, masks are not enough for protection. You have to have isolation for the sick. You have to have physical distancing and disinfecting services, etc. You have to have hand hygiene. So masks should be part of a comprehensive protection containment strategy. But masks are good at reducing droplets for normal speech. And everyone releases spit droplets when they speak. Those spit droplets can carry the COVID-19 virus. A Journal of American, I should use an acronym. Journal of the American Medical Association study showed 45% of COVID transmission occurred from people who had no symptoms and did not even know they were infected. Countries that introduced masking show a significant slowing of transmission rates, reduced death, and increased compliance with social distancing. A study from the US showed that mandatory masking would ease economic reopening without risking lives. Masks are very safe. I've worn them for up to 20 hours straight in the OR without issues, as have many surgeons and nurses. They take a bit of getting used to, but it's exactly the same as people learning to wear seatbelts, people wearing helmets, and people learning to wear protective clothing to prevent frostbite. It's the same philosophy behind wearing condoms to prevent STDs. It protects everyone. We chatted a little bit after that, and one of the comments that we both sort of came up with was the fact that, there's a lot of fear mongering out there about what wearing a mask will do in terms of CO2, poisoning, oxygen deprivation. And she made a very good point. She said, there are hundreds of thousands of doctors in Canada, doctors and medical professionals in Canada wear these things every day. And South Korea was predominantly masked shortly after the outbreak of COVID. And there is no epidemic of people dropping dead from oxygen deprivation, CO2 poisoning, or bacterial infections. So I put a lot of strength in what Dr. Alma had to say. She's frontline. She deals with this in her daily life, and I think that these words should be added considered very carefully along with the words from Dr. McGann.
Thank you for that, Councillor Knoll. The next speaker is Councillor O'Meara.
Thank you, Your Worship, and thank you for bringing the recommendation forward to my council colleagues there. We've all received a number of emails on this over the past week or so, and obviously there are a handful, I would say, of people who have concerns from a wide range of things, some of which Councillor Knoll just listed. And I just wanted to add my comments that, on this element, we have to follow the precautionary principle. We cannot wait and let perfection get in the way of doing the right thing now. We absolutely, we have to err on the side of caution because the disasters for human life and for our economy will be untold if we get this wrong. To ask residents for a few more weeks to wear a mask to ensure the viability of our businesses, to ensure the health of our residents is a very minor intervention. So I fully support this, and I thank the mover and seconder. Thank you, Your Worship.
Thank you, Councillor O'Meara. The next first-time speaker is Councillor Haslett-Theall.
I want to thank my fellow councillors for bringing this forward. I do have a couple questions. about wording and timing. So we talk about in the motion that there exists a pressing need. And I'm supportive of Councillor Giddings' suggestion that the special council meeting be set for July 16th, though I'll be candid and say I would have preferred it sooner. I'm concerned about this 7 days from passage that it becomes a requirement. Is there a way to make it required sooner than the 7 days, or to provide notice to businesses and residents that it will pass, that it will become law sooner rather than later? So July 16th or 17th. To me, the phrase pressing need means it's a pressing need. And when we talk about precaution, I'm not sure I'm comfortable waiting more days when the overwhelming message from residents has been put this in place now. So is there, I guess maybe the question is to Doug Carr, is there a requirement to have the 7 days? Is there a way to provide good notice now so businesses can prepare themselves but do not have to have this in place right now?
Thank you for your question, Councillor. I would call your attention to the fact that every other municipal bylaw is giving 7 days notice. There's a possibility that there was a good reason, but we have our own town solicitor on the line here, and we can toss this question to Mr. Doug Carr.
Yes, through you, Mayor Burton. Thank you for the question. It's not a legal requirement that there be a 7-day period before the bylaw comes into effect. It was a provision, I believe, of the Toronto bylaw that there be that period of time. And because the resolution speaks to passing a bylaw that's generally consistent with the Toronto bylaw, I think that's why we're seeing that period of time incorporated in the resolution. I believe it was, rather than a legal requirement, it was more of an operational deference to the businesses to give them an opportunity to get the signage up and to develop the policies, because the Toronto bylaw mandates that operators of businesses develop a policy. So I think it's to give them the opportunity to comply. So I think that's why that time period is there. But certainly the bylaw can be made effective at the will of council.
So with that answer, thank you very much for that. Today's July the 8th. July 16th would be the soonest we would have it officially passed, except if we take the regions. So we're talking about being 15 days from now before this is in place. I'm looking for the experienced people on council to give some perspective of, is there a phrase or way we could meet the need of giving notice to the businesses? Because nobody wants to disadvantage them. And in fact, I would comment that I've had some people say they don't go to businesses because they don't insist on masks. We want everybody to have a level playing field, but perhaps somebody could suggest a way to do this that lines up with the wording pressing need.
I don't know that anybody on council can give you that answer, but I have a speakers list of first timers, and I have a hand from the seconder of the motion. So with everybody's cooperation, I'll turn to Councillor Duddeck in case she has the answer to Councillor Haslett-Theall's question. Councillor Duddeck?
Thank you, Your Worship. I don't have an answer per se. I do have a suggestion. What if we were to provide it for the beginning of the next work week, i.e. the Monday? I'm thinking that provides some lead time in which people can have the weekend, per se, to plan for the following Monday for the beginning of the work week. Like, I'm trying to make it as simple as possible for somebody to be able to do it in a timely manner, but not sort of be caught unawares. I mean, I agree with you in regards to, I'd love to have it come in tomorrow. But the problem is we have to be respectful of, as Mr. Carr had said, people taking the necessary steps to be able to have signage or, you know, teach their staff that they want them to perform their duties a certain way. So I'd be very comfortable with the Monday, given that it's the beginning of the next work week.
Councillor Adams, you're the other half of this dynamic duo.
Thank you. I would be okay with changing it to the Monday following the 16th. It is meant to give time to businesses. It's also meant to give time to those residents who may not yet have gone out and find a mask or find a way of creating a mask. And if you imagine part of the point of having such a bylaw is to encourage those people who currently are not using a mask to do so, to pick up the habit. We are trying to give them some time to organize their lives around it a little bit as well. So I totally understand what you're meaning, and that's why we're bringing this forward to start with.
So, Council.
Your Worship,
Yes, sir.
while we're chewing on the question of this particular wording, going back, if I may draw our attention back to an original question. I know you've got a list of speakers, and so I wanted to flag an edit to the wording to respond to Councillor Knoll's question earlier, and that would be if you take paragraph 2 and edit the last part because we want to add in July 16th. So where it says at a special council meeting, it would now read to be held on July 16th, 2020 at 7 p.m. And I might suggest the following wording might help with the question of whether such a meeting is needed. That the sentence continue with, and that this meeting be cancelled should the region of Halton pass a similar bylaw to the satisfaction of the town CAO.
The only approval you need, Councillor, is your seconder.
Absolutely.
Okay.
All right. The clerk assures me that she's jotted that down accurately.
Very good.
Now, Council, let's try to remember, we're not in a situation of urgent threat. Our hospitals are empty of COVID cases. Our infection rate is extremely low. We've gotten here and flattened the curve with voluntary cooperation from the vast majority of our community. I'm happy that you appear to have agreed to give people some time to get their signs ready and their masks ready. And I would say that enforcement's going to be difficult if you don't expect to win a case where you haven't given people ample notice. Would be my thought on that. So let's try to play nice here on this. So the next first-time speaker is Councillor Elgar.
Thank you, Mayor Burton. I just like to say I'm glad to see this motion coming forward before us tonight, and that at the appropriate time, I absolutely would like a recorded vote. Up until 6 o'clock last night, I had received 256 at least emails, and of the 256, 227 of those emails were absolutely in favor of having masks mandatory, and which represents 89% of the people. An awful lot of good comments. Now, I did PDF the 256 and sent them to everybody this afternoon, and because I didn't want to have them all printed on paper for everybody. So, and since then, I've received more than 50, but the percentage is still the 89, 90% all want masks. So, to me, that's a pretty strong indication that the people of Oakville want this to be done, and they want it to happen now. And anyway, I'm really pleased with where we're going on this, and I really look forward to the recorded vote. Thank you.
Thank you, Councillor. Councillor Chisholm.
Thank you, Worship.
good discussion with respect to the timing. I'm of the opinion too that if we can be on the safe side, but also in a timely fashion with respect to getting this information out. I really believe the businesses and the residents of Oakville know this is coming, and they've been well prepared. Most of the business now that I've been associated with are asking for masks, and they're giving out masks on a volunteer basis. So I think it's out there, the practice is out there, but I totally agree with you. This is one of many aspects of how we can protect our citizens. And the mask is one. The mask is not 100% foolproof, but it also associated with hand washing and isolation to some degree are the benefits to reduce the COVID-19. With all in mind, let's get ahead of this. And I think this is one thing that we need to do as a council. And I want to thank Councillor Adams and Councillor Duddeck for bringing this forward. Thank you.
Thank you, Councillor. Councillor Sandhu is next.
Thank you, Your Worship, and thank you to my council colleagues for bringing this forward. I, as well as all of you, am in receipt of the comments from basically all of the information from our residents that we've been receiving over email and in person. And I know that Councillor Palmer went so far as to issue a survey, which has been extremely helpful as well. So my hat's off to her. And I also recognize, as any good officer of the court would, quite frankly, that we have a situation where the Charter of Rights and Freedoms allows for the right of liberty here in Canada. That right permits citizens to refuse such things like medical treatment without persecution. However, criminal case law does not permit parents or caregivers to disregard the welfare of their children or dependents via a circumnavigation of the Charter. And I think that therein lies the rub. We do not have this enormous duty that the judiciary has in our country. But I do think that we have a duty to our citizenry to ensure the safety of our residents where we're able. I would also say that we should be mindful and thoughtful about this from a business perspective and an insurance standpoint. People might be consenting of going into a business, but they wouldn't consent to getting the virus there. So if we have that obligation to our citizenry, we should also have that obligation and extend our duty to our residents and our businesses. And I think that this motion would encourage that voluntary compliance that we were talking about before and really ensure that protection in a practicality standpoint. So I'm happy to assist and agree with this motion. Thank you very much, Council, for bringing this forward.
Thank you, Councillor. The next speaker is Councillor Palmer.
Thank you, Your Worship. I thank my colleagues for bringing this motion forward. I am in full support. I also wanted to share that I did conduct an online survey for just the past few days just to gauge how residents were feeling on this topic. I had a chance to share that with council. And firstly, thank you to my colleague, Councillor Lishchyna, for working with me on drafting those questions. And thank you to all of the residents who participated and shared this survey across their friends groups. These are unprecedented times and we must adapt quickly, and recommendations are constantly changing, and due to emerging evidence as well as learning from other areas across the globe which have been successful in controlling the spread of COVID-19 using masks as a component of their public health strategy. So evidence shows that wearing masks indoors can help reduce the spread of COVID-19, along with continuing to wash your hands frequently and physical distancing and staying home when you're feeling ill. And I just think that this would be a step in the right direction for us, and quite frankly, a step that majority of our residents are already taking. So thank you to my colleagues for bringing this motion forward, and I will be supporting it.
Thank you, Councillor. The next first-time speakers are Councillor Lishchyna, Councillor Grant, and Councillor Robertson.
Thank you, Your Worship. I too want to add a few points to this discussion. We all know that face masks to prevent or slow down transmission of disease have been in existence for many years, way before COVID-19. So this is not anything new. There are countries who've adopted universal face mask wearing in public places, and it's become the norm. It's not the norm in Canada. And in fact, a lot of people feel stigmatized by wearing a face mask. And by instituting a mandatory face mask for indoor public spaces, I think will level the playing field, and no one should feel stigmatized for doing the right thing. Models have been actually confirmed by real life situations that if at least 80% of the people wear a face mask, then perhaps should a second wave come or anything more significant, we would have actually a significant cut in infections. That's huge. Now, the 20% room actually leaves for exceptions. And we have exceptions in some of these bylaws that we've seen, including the Toronto bylaw. So some people say that this is a political decision. Yes, it is. It's a political decision. Governments or people elected to government are people who are responsible for keeping the safety of our citizens. And by instituting this law, we are going to do our job. Based on the response of the people who've submitted their comments, the majority agree. And so I'm going to be pleased to support the bylaw locally if it's not instituted regionally, although I do hope that it is instituted regionally because it will be better to have it uniform across our region. Thank you.
Thank you, Councillor. I'm adding Councillor Longo to the first-time speakers list and turning to Councillor Grant.
Thank you very much. Thank you to my colleagues. Just back to the motion itself. When we're saying that it is going to be generally consistent with the Toronto bylaw, does that mean that we're going to be generally consistent with 2A, which has a number of the exemptions, which would be for children under 2 years of age, people who are unable to remove a mask themselves as it goes on? Is that what we're trying to accomplish without actually saying it?
Yes, that's correct.
Okay, great. And I'm happy this motion came forward. Certainly I spend some weekends looking after some seniors and picking some fresh produce for them at a grocery store the other weekend. I was surrounded by people not wearing masks in a produce section and felt very uncomfortable. And I'm looking forward to a time where people understand that they need to either socially distance or wear a mask if they're going to be that close to other members of the public. So thank you very much.
Thank you, Councillor. Councillor Robertson. Councillor Robertson, there's a muting problem there.
I can't find my mute.
You did. You found it because we can hear you now.
Oh, thank you. I know that I was very torn on this. I was torn because I saw the initial request that urged residents to please wear masks because we had low numbers. We didn't see ourselves in the same need as Peel or Toronto with their higher density and their larger numbers. It has been a very difficult week for me in seeing that piece that goes with the rights and hopefully seeing that people would do this on their own, to recognizing the fact that people really are afraid for their own health going into public spaces. And I see no way to fight that fear for them unless I support this motion, which means, yes, I am supporting this motion. That said, I really want people to know that you must understand that there are people that will not wear a mask because they have medical issues. And the divisiveness I've seen on social media, the divisiveness I've seen in emails, leads me to believe that people will judge so harshly those that do not wear a mask. And I know that even where it's mandatory, there are times when enforcement cannot come by asking, do you have a medical note with you? Please assume that this gets passed. People that do not wear a mask have a reason, and that's their reason. Be kind. Wear your mask. Be proud to wear your mask and keep going on the flattening the curve. Keep going so we don't go into a second wave. But please be kind to one another and don't judge. And yes, thank you for the motion, and I will be supporting it.
Thank you, Councillor Robertson. That brings us to Councillor Longo.
Thank you, Your Worship, and thank you to Councillor Adams and Councillor Duddeck for bringing forth this motion. I think it's extremely important as part of the reopening of the economy. I think the science is there, working with healthcare workers every day. I think it's really important as one of the tools to help prevent the further spread of this. So I will definitely be supporting this motion with the amendments to it. And I've been receiving that feedback from via email and in person from constituents who are also supporting it. So thank you for putting forth this motion. I think it's an important part of this, the reopening and getting back to normal if we can. Thank you.
Thank you, Councillor. I believe that's everybody for first-timers that I know about. Are there any second-time speakers? Shall I call the registered delegations? Madam Clerk, Council, we will wait while the technical forces at our back and call here hook us up with our first registered delegation.
The first registered delegation is Michelle George.
All right. Welcome, Ms. George, if you can hear me, and if you can't, I'll welcome you when you can.
Good evening, can you hear me?
Yes, we can. Welcome, and thank you for taking the time to call in.
Thank you, I appreciate the time. So I do thank you for allowing me this opportunity to be heard on what I do believe is a very hotly debated topic. I'll just give you a quick snapshot of myself. I am a mid-50-ish female with, so who fits the Halton's demographic of the highest incidences of COVID infection. But I have managed to stay healthy. I continue to work full-time outside of the home. I practice safe social distancing and regular hand washing. So I have in the past attempted to wear a face mask, either at grocery stores or other retail establishments. And what I'm about to share with you is based solely on my experience. And I neither profess to be a scientist nor a medical professional. So what I can tell you is that the times that I have attempted to wear a face mask, I have had bouts of dizziness, lightheadedness, headaches, mild disorientation, and the headaches would persist even after the mask was removed. I have a friend who is in engineering, and they suggested that I test my CO2 levels. And I know this has already been brought up by Councillor Knowles, but I will say that my CO2 levels in an enclosed space were substantially higher than the, I guess, the normal rate. So if you're not familiar with what a normal rate of CO2 levels would be, typically in an occupied space with good air exchange, you're looking at between 400 and 1,000 ppms. Anything over that, you start getting complaints associated with drowsiness, headaches, sleepiness, poor concentration, lack of attention, increased heart rate, slight nausea, as well as increased blood pressure. That being said, I can appreciate the concern that we are facing right now with COVID being so prevalent around the globe. But I think what is being failed to be acknowledged is that one method will not suffice for every individual. So I'm going to draw your attention to a 2012 study titled "The Use of Masks and Respirators to Prevent Transmission of Influenza, a Systematic Review of the Scientific Evidence." And this study looked at 17 of the best studies in the field and concluded that none of the studies established a conclusive relationship between mask use and protection against influenza infection. So I feel that even based on my personal experience and the 2012 study, and then the World Health Organization also comes forward and says on their website that they have limited evidence on the effectiveness of non-medical fabric masks. And at the present time, the widespread use of masks everywhere is not supported by any high-quality scientific evidence. And there are potential benefits and harms to consider. As Councillor Robertson said, that we have to sort of accept that there are people out there that are unable to wear a face mask. And to make it mandatory across the board, I feel is unfair to those individuals who are unable to wear a face mask for whatever reason.
How long has she been going?
That's all I have to say. Thank you.
Ms. George, I don't know if you're aware, I just wanted to check, in the Toronto bylaw that we're modeling ours on, there's a list of exceptions that would fit your case and many others. Were you aware of that?
No, I was not.
Does that relieve some of your anxiety?
Maybe after I read it.
All righty. Thank you. I really appreciate you bringing your information. You know, as I said earlier, we have come a long way with voluntary compliance, and the example that you described yourself setting is very good in terms of, you know, you're in one of the more vulnerable groups, and you've continued working outside the home, and you're practicing social distancing and hand washing. And Dr. McGanny certainly stressed that staying home when ill, washing hands, and keeping your distance are far more important than masking. So thank you very much for adding your information to what we have to consider.
Thank you for hearing.
Thank you. Madam Clerk, would you call the next delegation?
We have a phone-in delegation, Derek Quinlan.
Thank you. Mr. Quinlan, welcome, if you can hear me, and if you can't hear me, I'll welcome you when you can.
I can. Thank you very much for hearing me. Well, it seems that most of you have made up your mind and that this bylaw will pass. I would just like to, however, to have a few points noted. In Canada, what I like to think of as a free country, one should have the right to make their own decisions unless they're interfering with the rights of others. You know, their own individual rights, though, should not be subject to another person's rights being imposed upon them unnecessarily. I'd like to also bring up, in regards to the city of Kingston, many of you, I hope, are aware that, and yes, Kingston did just pass its own mask bylaw, but Kingston was COVID-free for quite some time. They then had an outbreak, which led to 39 cases in Kingston. I just wanted to point out, though, that every single one of these 39 cases, and you can check with Dr. Kieran Moore, their public health director, is directly traceable to prolonged close contact, initially from the nail salon workers to their clients, and then to their co-workers, spouses, and children. Not one of these 39 cases came from casual indoor contact, whether it be at a grocery store, mall, or local shop. Does Council have information about the 12 currently active cases in Oakville that would suggest that any of these exposures was through casual contact indoors while passing by, say, at the Home Depot or local Sobeys? If so, I would appreciate the town or Halton Public Health share that info with the public to further educate us, as Dr. Kieran Moore did in Kingston, in informing people who became infected and how they became infected. I think that every single person has the right to wear a mask, and if that makes them feel comfortable. I've also noticed that sometimes when people are wearing masks, they do not respect social distancing. I know I always follow social distancing, and I have worn a mask, and I've also not worn a mask, based on my personal view of how the situation was in the store that I was in. And also, I know some councillors were talking about rushing the timeline. 3 weeks ago, there were 34 considered active cases in Oakville, and that includes laboratory confirmed as well as probable cases. Today we're at 12. By the time you have this meeting next week, God willing, we will be down to single digits. So while council will make its decision, and it sounds like it's already been made, I don't know what the point of rushing things is at this point with our current low level under current practices with social distancing. Thank you very much.
Thank you, Mr. Quinlan, very much for those thoughts. The next delegation, Council, that is the extent of our public delegations. Councillor Haslett-Theall, and then Councillor Chisholm.
I want to start by thanking the delegations for speaking up and sharing their views. I think we always appreciate hearing different perspectives, and we did receive some emails that way. My question is in regards to, and maybe Doug Carr has to answer this one again. How binding is this on daycares? Because we're talking about putting 2-year-olds, if we model Toronto, asking somebody, a child who's 3 and up to wear a mask. Is anybody aware if the daycares have been consulted on the application of a mask in their environments?
Councillor Adams, from your recollection of the Toronto bylaw, does it even apply to daycares?
It would not apply to certainly the younger children who are under 2, and for any others who would have difficulty managing a mask, they would also be exempt.
So just...
if the children are your concern specifically.
Well, the children are my concern. I mean, but I'm also empathetic to the daycare operator who is, if they're bound by this, if they're a private daycare and are bound by this within the town of Oakville, I would ask that at the regional level, if you can have Dr. Magani and have some further discussion about whether or not that is even feasible. And if the language is written in a way to understand, I don't know, maybe my children were different, but below the ages of 5, trying to get them to put their boots and their shoes on. Now we're asking them to put a mask on. So I would just ask if there could be an exploration of what is an on the ground reality, and to not disadvantage the daycare operator, because we clearly need our daycares to operate right now. We cannot have parents not having their services. And then my second question follows from that, is just in terms of the school boards. Has there been discussion with the school boards about masks for September?
Councillor, we have the Toronto bylaw here. Businesses that are exempt include childcare facilities.
Perfect. Okay, I did not have the Toronto bylaw in front of me, so thank you.
Thank you.
Does it exempt schools or does it apply to schools?
Schools, would you like me to read the list?
Well, I think the public would probably like you to read the list. Sure.
It's available. Schools, post-secondary institutions, childcare facilities, private and public transportation, because transit has its own regulation.
Yep.
You remember. Hospitals, independent health facilities, offices of regulated health professionals, apartment buildings and condominiums, including their common areas, because they have the power to do their own regulations. An area that is not enclosed or indoors, e.g. a restaurant patio.
Thank you.
You're welcome. And I apologize to the laptop or the iPad. Councillor Chisholm is next.
Thank you, Worship. I guess I'm looking down the line now with respect to this motion being approved by council. But I guess the question is the enforcement side of it, and what does that mean and what's that entail is my concern. With respect to that, do we, as we do have now, if I'm not mistaken, we have a line for people to report about people not distancing in parks and so forth. Does this now move into that realm of people calling saying they're not wearing their mask? Or how do we deal with confrontations? Looking at the possibility that this might happen and how we're going to handle that.
Councillor, that's a matter for the actual wording of the actual bylaw, which will come before you, and at that time you'll be able to make sure that you're satisfied on that point. But in brief, yes, people will be able to call 905-825-4777 as before. Is that satisfactory?
Thank you.
You're welcome. Councillor Robertson is next.
Unmute this time. A couple things. Sean and I had many emails about the amount of people down in Bronte. And there were several suggestions that they wanted to see outdoor masking. I would very much like to have a guarantee that outdoor masks will not be required. Please?
Well, the motion before you doesn't call for outdoor masks. I can't forecast what will happen at the region, but you will have the opportunity. Well, actually, and the region would trump anything we pass. So if the region is stricter, you can't be less strict.
Okay, I think I understand that, although I thought that was part of if things, according to the region, were not exactly how we saw fit for our own community, we would readdress this. Did I miss that in here?
This doesn't ask for outdoor masks.
Okay.
This doesn't guarantee that the region won't do it. I'm not aware of any move to do it at the region, but it's a possibility. So I'm just trying to alert you to the fact that should the region pass one and have a requirement for outdoor masks, we would not be able to get out from that because the region, covers us.
Okay, thank you. Then my other two things, apartments and condos are not included, although it doesn't specifically say that. They are indoor spaces with many people with an open foyer and many of them. But for residents' sake, they're not included, correct?
Yes, they're correct. And apartments and condos are mentioned. It was.
Oh, sorry,
It was
I missed
apartments
that.
and condos and places with, not places with.
Okay. And my last one was in terms of face coverings. I listened to Dr. McGanny tonight on the news, just before coming into the meeting, where she said that face shields did not count as a face covering. So she said because there is ample room for droplets to get in under a face shield. It was not. So I just wanted to make sure of how that stands in terms of what we include in face coverings.
That's perhaps a question for Councillor Adams, but I believe that it's clear in his language that
the Toronto bylaw has a specific definition of what mask or face covering is, and it means a mask, balaclava, bandana. I'm seeing hand signals there. I was wondering if that meant you could hear me. A bandana, scarf, cloth, or other similar item that covers the nose, mouth, and chin without gap.
So
thank you. Mostly I want the public to hear this because they may not read it, and this is the forum to get them to understand.
And one of the reasons for using a similar bylaw as in Toronto is to create consistency in messaging in the public, so that people get the same message and there's not as much confusion.
thank you, councillors. Councillor Palmer.
Thank you, Your Worship. Question for the councillors that brought forward the motion, and I'm just looking for some clarification here. So I just reread it, and so I saw the whole 7 days, and I'm just wondering, we've been talking a lot about just adapting the Toronto bylaw. So I'm just trying to understand, it seems that if we're copying the Toronto bylaw, that it would be fairly quick for staff to turn a bylaw around like that. So why couldn't we ask staff to bring it back sooner? For example, and I'm just throwing this out there to kind of have my question answered, if staff was to bring that bylaw to this council this Friday, then 7 days from then would allow this to be in place by July 17th. And if the region passes something on the 15th, that would just supersede this, but would give us protection earlier. So I'm just trying to understand the whole 7 days and where that really comes from, and why we're waiting for the region to do this and not bringing it forward as a municipality sooner.
Councillor Adams, had you already agreed to change it from 7 days to the next Monday?
I had not actually agreed to change it to the following Monday yet. But to answer the question about could you bring it sooner? Yes, you could probably ask staff to bring it back to an emergency special council meeting tomorrow and try to have it pass. You'd have to ask Mr. Carr whether he would be able to turn it around that quickly. But in any case, I think that one of the issues that you would have is if we passed one here and then immediately revoked it on the 16th, the day before you were to enact it, I think that would create some confusion in the public. And so I think we're better off not creating mixed messages around passing and then revoking a bylaw. We're better off having a bylaw passed and having the public education being consistent.
Thank you for the clarification.
Thank you, Councillor, for the question. If there are no other questions, may I put the vote? It'll be a recorded vote. Councillor Duddeck.
Thank you, Your Worship. I just wanted to offer a few comments before we do take the vote. First, I'd like to thank you, Your Worship, for bringing forward and preparing a report and calling this special council meeting to provide both council and the public the opportunity to weigh in on this important issue. The amount of public engagement on this issue, either through social media, emails, or phone calls, has clearly indicated that there's a strong support for moving forward with mandating the use of masks in Oakville. And as pointed out previously, in fairness, I have heard from some others who were not supportive of implementing a bylaw. Having witnessed the excellent efforts our community has demonstrated in flattening the curve with this pandemic, I was originally quite hopeful that further efforts would not be needed. However, upon entering phase 2 of the recovery process, I've witnessed more and more a disregard for the previous safety steps being taken. Shoppers are no longer adhering to the directional arrows that were provided in stores to maintain safe distancing. In fact, people are no longer hesitant of reaching over another shopper to obtain their purchases. I've heard of some instances with some of the store owners who've experienced difficulties getting the customer to adhere to the guidelines that specific retailer has established. Throughout this process, we've repeatedly heard the phrase, "We're all in this together." And therefore, I'm convinced that we all have to do our part to not only maintain our lower numbers today, but into the future when we may very well face a second curve or wave of this disease. Wearing a mask provides another tool, it's not the only one, in battling this disease, not only for ourselves and our loved ones, but for others in our community, especially our frontline workers. I'd ask that you seriously consider supporting this motion, which I understand it would indicate, as my mother used to say to me, an ounce of prevention is worth a pound of cure. And it wasn't until later in life I realized she took that from Benjamin Franklin.
Thank you very much, Councillor. I remember your mother well. Councillor Elgar?
Yeah, through you, Mayor Burton, I just asked whether if staff could send us a copy of the motion that we're going to be voting on tonight. I've got a number of people that would like to see what we approve tonight. So if we could, she could shoot that out to us with the minor wording changes that Councillor Adams and Duddeck are proposing, that'd be fantastic.
It shall be done. All right, to show support, or rather, I'm going to ask in my customary manner, is there any objection to the motion? Madam Clerk, I see no objection. A recorded vote was called for, so please record the names of all the councillors and myself in support. Council, I want to thank you very much for your thoughtful consideration of these matters and your recognition of the different viewpoints that do exist in our community. I want to take 1 second to say, we're doing this to protect the future. I don't believe that we are under an emergency. I don't have a sense of you know, a burning, urgent need to do this effective at midnight tonight. I believe that what we're doing is prudent and for the benefit of a continued economic recovery of our community. As we look to the south and we see what happened when people became very incautious when they reopened, and it's not like they're having a second wave, they're having a second mountain, and we don't want that. So with that, I will look to you for a mover and seconder for consideration and reading of our bylaws. And Councillor Longo, Councillor Sandhu, thank you. Any objection to the 2020-86 bylaw to confirm the proceedings of a meeting of council? Madam Clerk, there's no objection. I declare the bylaw is adopted. That completes the matter that we could consider here. And I want to thank you for all that you put into it. And it's been terrific working with you, and we are adjourned.